Hello, and welcome to a welcome back to Sharp Scratch. This is a podcast brought to you by the BMJ, where medical students, resident doctors, and expert guests come together to talk about things that you need to know to be a good doctor, but might not get taught at medical school. I'm your host, Zaynah Khan, a medical student in London, and this year the editorial scholar, running all things BMJ student, including this podcast. And I have some wonderful people with me today on this episode. I'd like to introduce you to our panel first. Today we have Anna De Beer and George Webster.
Hi, my name's Anna and I'm also a medical student from London.
Hi everyone, my name's George. I'm a final year medical student at the University of Warwick.
And George, I might actually let you introduce our guest today because I know this episode was something that you suggested and you were quite passionate about. So why don't you tell us a bit about that and introduce our guest?
Yeah, absolutely. So I think the reason I wanted to do this episode firstly is because I'm a medic who wears hearing aids. I'm hard of hearing. And I wanted to bring on Benedict Richards, who is also a medic who wears hearing aids. So I thought we could just talk a little bit about our experiences as medical students and now Benny as a doctor, being hard of hearing and what that's like for us and how people can kind of support us.
Hi, I'm Benedict. I went to University of Warwick with George. I graduated in the summer and now I'm working as a foundation doctor in the West Midlands.
Thank you all for coming on today. I'm looking forward to this episode because I'll be honest, I don't actually know very much about the experience. And of course, Benny and George, you both have like that lived experience that we're going to talk about. And Benny, of course, the experience in like clinical practice as well. And yeah, I think myself, Anna, and like the audience would be really excited to learn and hopefully see ways that we can help understand and support, I guess. So I guess what I wanted to start off by talking about was in terms of medicine, one of the first things that we think about when we're in a clinical setting is like the sensory environment. Like when you're in a hospital, you're thinking about all the smells of the antiseptic or whatever, and you're thinking about the beeping noises and all this random background stuff, and if there's a baby crying or I don't know, whatever is happening in bed 12. But that sensory experience makes up a really big part of how we go about interacting with medicine as a medical student, a doctor, or patients, or anyone else involved. So I guess in terms of this episode, before we were discussing that idea, I feel really ignorant, but I never really thought about what would happen if you were hard of hearing and how that affects your experience. So I guess I wanted to start off a little bit by asking you, Benny, what that's like. What's it like kind of being hard of hearing and navigating medicine?
I think you're right. You were saying about like the sensory experience of being in hospital. Like it is sometimes a bit of a sensory overload. Especially on the wards, there's all these beeping noises. There's various like members of staff talking to various patients at the same time, often like just separated by like a thin curtain rather than like any sort of actual privacy. So like it can be quite overwhelming in that setting. And I think especially when I was a medical student, like starting out on placement, that was like so much. And I think at the time, maybe I didn't really appreciate how much that was. And I'd come home exhausted from a day of placement and be like, wow, it's really hard being a medical student, which obviously it is. But like, I think maybe at the time I didn't really appreciate the fact that perhaps there was like an extra toll there because like hearing aids are clever, but they're not like magical, so they don't necessarily know what noises to amplify and what noises to kind of zone out. So sometimes there'll just be like all of these beeps going on, or like you'll be sat trying to take a history from a patient in a bay and all you can hear is the next bay's patient talking to their family about what they'd had for lunch, or the consultant in another bay like berating somebody, or like maybe that's a generalization, but so like it's not very good at sort of like discriminating what sounds to pick up, so that can just result in everything being super amplified and not actually being helpful.
How do you find that, like, if it's a chaotic environment, like, say a patient is crashing, maybe you haven't experienced that, but like, if something like an emergency is happening, how does that affect your experience?
I guess, well, I'm quite lucky in the sense that I haven't been in too many of those situations. But I think people try their best to sort of like make allowances, or like, when you've told people about your like that you're hard of hearing, and they make a bit more of an effort to like look at you when they talk to you, and make sure that you can read their lips, or that they're talking at a loud enough volume. But I guess when there's like an emergency scenario, that all goes out the window, because understandably that's not the first thing that's on their mind. So probably like I said, I have limited experience from that, but like what I can imagine is that well, it is a more chaotic environment, so it will be more difficult to follow conversation streams. And if somebody's like looking at the patient but shouting out, like, somebody go and do a VBG, somebody do this, do that, like, it's already going to be much harder to hear what's going on, because you haven't got people looking at you when they're talking to you. Or if people are panicking, they're talking quickly, or if they're stressed, they might be mumbling. Like, there's so many different things that I think would like affect in that scenario.
Hmm. I think one thing you picked up on there as well is like lip reading. Say if wearing face masks and stuff, I don't know if that happened while you were on placement. How did that affect your experience?
It had a huge effect, like right from the off, to be honest, because I started medical school in 2021. So we're kind of like still in a sort of time where they were quite commonplace. Like, and I guess because like the pressure of it being a medical school, obviously they had to be seen as taking it very seriously. So in my first year of medical school, a lot of the teaching was delivered online. A lot of the stuff that was in person, everybody had to wear face masks, which was super, super challenging, and more so than I anticipated as well. Because prior to medical school, I worked as a healthcare assistant in a GP practice for a couple of years, and that was where I worked for the bulk of the pandemic. So like I'd had experience of wearing full PPE and the limitations of that and how that affected my hearing, but because I was working in an environment where I was predominantly one-on-one with a patient in a small consultation room, there wasn't really any background noise. Like the sound wasn't getting lost in a large room, so I did largely cope quite well despite the barrier of the face masks. But as soon as I was in like at university, when you're in like larger classrooms and there's multiple conversations going on at once, and the other people in those conversations aren't necessarily aware of your hearing impairment, it did have a huge impact.
So I think one thing that we're talking about is kind of like a lack of awareness or lack of understanding. So I thought we could play some clips that Georgia sent through that we can listen to and hear what some people's experiences of being hard of hearing is like. And this audio is recording in a pub garden, which is arguably as chaotic as a hospital at times. First, we're going to play what it's like for somebody with no hearing loss.
I read in the newspaper today that a new theatre is opening. Isn't it great?
Sure is. What plays are they showing?
I think it'll be the one we saw last year. Do you remember?
Now, this is mild hearing loss.
I do. Do you want to go and see it again?
The play is so good, it'll probably be worth it.
You're right. It's always interesting to see if they do it a different way.
The director is really
Now for moderate.
unknown as well.
You do directors usually have a different perspective of showing things too. We should see that play.
Good. Let's ask some friends. I'll find out who's interested.
Okay.
Now this is severe hearing loss.
We'll have some time to make arrangements, right? The theatre won't open for another 4 months, but I'm sure they'll start selling tickets soon. In that case, we should buy the tickets. They'll sell out fast. Right,
And now for profound hearing loss.
Yeah, so I've listened to these clips and I have moderate hearing loss. I would say it's pretty accurate, but it's hard to know because I think the easiest way to describe it to people is if you've ever put earplugs in and then taken them out, it's kind of the opposite. That's how I would describe like putting my hearing aids in.
My favorite way to describe it is when I take my hearing aids out, it feels a little bit like, when you're on a plane and your ears pop. Like, and actually, when I first went to the GP about like being hard of hearing, I was like, it feels like my ears are blocked all the time, but it wasn't. Like, they weren't. It was the hearing loss. So I think like the best, or like trying to hear underwater as well, is another good way of thinking about it. And I think that like a real thing to highlight is that it's so much more about the clarity than the volume. Like I can have a conversation with somebody without my hearing aids in the right conditions. Like it's just as much, if not more, about the clarity of the sound as it is about the volume. Like I could go to a concert and it will still be deafening. Like maybe that's not the best word to use, but like it'd still be super loud for me. But it doesn't necessarily mean that I can hear what's being said, like when the music artist is talking to the audience or something like that. It won't be about the volume, it will be about the clarity. And I think everyone can probably relate to that in like a busy pub or something. Like everyone can hear there's noise, but you can't make out what's being said. Even somebody with no hearing loss.
Like a conversation when you're hard of hearing and you're like in a nightclub and someone's talking to you and you're just like, nope.
But then like even somebody with no hearing loss to have a conversation in a nightclub, it's quite difficult, isn't it?
Exactly.
So like if anything, maybe someone who's hard of hearing who's used to lip reading might cope better in that environment than somebody who isn't.
I tend to just take my hearing aids out. I'm like, I'm just gonna have a hearing aid free night tonight. I always equate it to like you know when you like take your bra off at the end of the day. That's my equivalent.
I knew that was coming.
My equivalent is like taking my hearing aids out.
No, like to be fair, I used to do that when I was in my undergrad, and every time like the security people would like at the beginning they'd like search you, and I'd have my little hearing aid case, and they'd be like, they look at me like really strangely, and then I'd say it's for my hearing aids, and they'd go bright red and let me kick it.
Something that you said, George, that I found quite interesting. Well, not interesting, but something that I didn't think of before. But you were talking about your experience in lectures and not being able to like lip read or that kind of thing. One of the clips that you sent through was actually the experience of it in a classroom. So I thought that's something that we could play now and hear what it might have been like.
This is what speech sounds like when it is recorded through the microphone of the hearing aid. I am now at the optimal listening condition of about 3 feet away from the microphone of the hearing aid, and there is no noise in the background. For the hard of hearing student in the regular classroom, this ideal listening condition rarely exists. The first condition we would like to demonstrate shows what happens when the teacher walks further than 3 feet away from the hearing aid. I'm going to walk approximately 10 feet away, and as I do, you will notice that the loudness and the intelligibility of my speech decreases. Mary had a little lamb. Her fleece was white as snow, and everywhere that Mary went, her lamb was sure to go. And here, at 10 feet away from the hearing aid, you should notice that you have a very difficult listening situation for the hard-of-hearing student in the regular classroom. As I walk back towards the hearing aid now, you'll notice that there's an increase in the loudness and the intelligibility of my speech until I am once again back at the optimal listening condition of about 3 feet, and you should hear everything with little difficulty.
George, how did you find it?
I've watched it. So when I watched it on YouTube, I thought it was quite a good example of kind of what hearing aids sound like.
Mm-hmm. I wanted to ask, there was like a buzzing noise in the background. Is that just poor quality recording, or is that what the experience is like?
My hearing experience is that I think sounds sound quite robotic. So but also I've got tinnitus in both of my ears. So my hearing experience often has like tinny and like ringing and like various noises, and I'm not always sure whether it's my hearing aids or my tinnitus kind of interacting. So, but for me, the video was quite accurate of what sounds sound like for me through my hearing aids.
I've just got a new set of hearing aids because I was having a lot of issues with my previous set, and I probably need to go back to my audiologist and get them tweaked slightly, because at the moment everybody sounds like they have a lisp.
Okay.
Which is so unserious when the consultant's on the ward round and they've just got like a really heavy lisp that they've never had before. But yeah, that seems to be, although my flatmate who does normally have a lisp seems to no longer have a lisp, so it cancelled that out.
Okay.
But it's very unpredictable.
And how did you find like with the distance? Because I was thinking in terms of 3 feet and 10 feet, you're not really going to be within 3 feet of a teacher in a lecture unless you're like in the front row if you're talking to them one-to-one. So how is it from a distance? Like if you're at the back of the room or something?
It's impossible. I rely on captions in lectures. If we ask that they put closed captions up on all, or like live captions on all lectures. Without that, useless. I think me and Benny probably would often be sat in the front row, especially if it was a lecture that we wanted to take in the information from. We're probably going to be sat in the front row. If we're sat in the back, I'm not listening. I'm
Okay,
not
eager
really
beaver.
No, we would always sit at the front of a lecture, wouldn't we, Benny? Always. But yeah, the distance definitely is accurate. I think people don't realize how much of a difference it makes how far away you are. But there are going to be some distances where I'm not going to be able to hear. Like when people try and talk to you and you're like in a different room.
Oh, yeah,
Not.
okay. That's not happening. So we've spoken a bit about the sensory experience and tried to listen to what that might be like. I wanted to talk a bit more about the experience in medical school. I was wondering in terms of hearing and stuff, like, what is that like in exams? I don't know if you had any anecdotes or examples of when it affected you during any exams.
I know me and Benny have spoken about this before. I think we've had similar experiences. I had an OSCE where my feedback was that I lacked confidence because I kept asking for questions to be repeated. And this was prior to me having, our university gives us out a little red card, and the card says, be aware, you give it to the examiners, it says, or they have it, it says, be aware, this student is hard of hearing, they use hearing aids. They might ask you to repeat things for clarity. This isn't because they haven't studied for the exam, it's because they probably just can't hear you. And then they might use things like clear face masks. But I think, Benny, you've had a similar time. But of course, we go to the same university.
Like in my first year, like I struggled a lot with the sort of like when we'd have clinical skills sessions and stuff like that, I'd really struggled because those were environments where we'd have to wear the face masks, and they were meant to put allowances in place for me, like for OSCEs. And there was a scenario in my first year OSCE where I had this thing they called I think it is called a red card. So essentially like a summary that gets put in front of the examiner that says like, well, mine said something along the lines of like, just to let you know, this student is hard of hearing and uses hearing aids. Therefore, you need to wear like a mask that's provided with a clear window so they're able to lip read, and also be mindful of the fact that they might ask you to repeat themselves, and it's not because they're not engaged or they're not listening or they're trying to buy time because they don't know the answer to the question. It's because they have a need for it to be repeated. And I had a scenario in my first year OSCE. I think things were starting to lift. This was like 2022, summer 2022. I think things were starting to lift, so it became optional for people to wear the face mask. So not every station had someone wearing a face mask, but on one of the station they completely missed the memo and they were wearing their own like cloth face mask from home. And the feedback that I got from that station when I got my results a couple of months later was like that I was underconfident, and that that I kept asking for them to repeat questions, and I remember in the station really struggling to hear what the examiner was saying. So that was really frustrating for me because A, that person just hadn't even considered what the red card had like outlined, but B, it kind of really highlighted a lot of the struggles that I had over the course of that year. And another one, I guess, while I'm on that topic, was that in another station I had to do a manual blood pressure, and the way that my stethoscope works is that it at the time it connected to a little receiver via like a cable, and then that connected to my hearing aid. But it takes like, I'd say 30 seconds to a minute to sort of like set that up and then change the channel on the hearing aid so that you're able to hear through the stethoscope, and then the signal is like ropey at best, to be honest. So I ended up running out of time in that station to complete the activity and then failed the station, even though manual blood pressure was something that I was very confident doing. I did it as a HCA before I was at medical school. So like that was just another scenario where there was a real frustration because there were no allowances made for the fact that actually I did need extra time to use my equipment, and there was no sort of flexibility in order to allow that at that point. They made changes further along through med school, but
I'm glad to hear that they're making changes. That sucks.
so not just in exams, but I also had a situation where in one of my blocks, I was pulled aside by the person who was in charge of that block and told that consultants had raised concerns about my engagement in teaching sessions and said that I seemed disengaged during the teaching session, when the reality is I was really struggling to hear what was being said despite positioning myself at the front. And that was an example of where the university had failed, or maybe the medical education department at the hospital had failed to communicate my additional needs to the staff delivering the teaching. And the result was that a false impression was given on me where it was implied that I was disengaged and wasn't paying attention to the teaching, when I was just really I was trying to follow along on my iPad, like the slides, and they took that as me like doing something else or not being engaged in teaching. So that was super demoralizing, and that was a point where I had to kind of raise with the university, like, look, this has been a recurring issue. This shouldn't still be happening. Like, someone needs to do something about it. But then I had like two very different experiences where one member of staff was like, oh, I understand that a lot of the time the onus is on you to try and like tell people or to try and come up with ideas to make it better. And she did a very good job of taking that onus off me and volunteering to be the one to email the trusts in advance of each of my placements. And it sounds like such a small thing, but it made such a huge difference. Whereas another person would be like, oh, just make sure that you email them before the start of the block. But then when you get all the other things like anxieties about starting a new placement block, and it just feels like the last thing you want to do is like putting yourself out there and sending an email to be like, by the way, please take this into account. So it just shows that what might seem like a really small thing for someone to do, or might seem like a small task that I should be able to get on and do myself, can make a huge difference. So that was another positive experience where someone acknowledged that although that's seemingly a very simple task, the mental toll that takes on somebody who's repeatedly having these bad experiences, and it made a huge difference to me that member of staff was willing to make sure that each placement was aware. That some of the smaller trusts that we had placement at were a little bit better at identifying that as a cause of a concern, and at one trust in particular, they reassured me at the beginning of the placement that I was with them that every time I had bedside teaching, they had a classroom booked out for us to go back to receive feedback, rather than being in like the cleaning cupboard on the ward or something ridiculous, trying to find somewhere quiet to give feedback. So that was something that was like super, super helpful. Because I want to try and like make sure there are some positive. I don't want to spend the whole time like bitching about my time at medical school and my time in clinical practice, because there are things that have been super, super helpful as well.
I think one of the things for me with clinical placement is they're not always expecting a medical student who wears hearing aids. So in my experience, like the negative experiences I've had have been based on the fact that people, one, don't expect a medical student to be hard of hearing or wear hearing aids. And they might make, I had a comment, I went into theatres and somebody was like, take those things out your ears before you come in to the operating theatre. And I was like, I won't be able to hear. And she just had there was just like zero expectation that I could be a medical student wearing hearing aids. And she just...
So they thought it was headphones or something. Yeah. I've had a similar thing from a different perspective, comments from patients as well. So that can be quite difficult to navigate, because I feel like with staff or like education stuff, you can kind of like raise it to university, but dealing with comments from patients, it's very difficult to know where you stand or what you can do with that information. But I've had in the past where a patient has said to me like, oh, you're too young to be deaf, like why are you wearing those, and just like ignorant comments like that, or like, oh, should you really be a doctor if you can't hear properly, and things like that, which is obviously very disappointing. But then on the flip side, I've had comments where, like recently when I've been on call working in A&E, like where I was examining a patient and I explained to them, oh, my stethoscope looks slightly different because it connects to my hearing aids, and just give me a moment while I set that up. And she was like, oh, wow, my daughter's hard of hearing, and she's like, we're really worried about what she's going to do like after school and what she's going to do for a career. So like, it's amazing to see that you're out here being a doctor. And that was something that like genuinely meant the world to me, like just to hear that story, because that's kind of like trying to find positives in living with like hearing loss, being able to like hear people say that they felt inspired by that. It's just like really nice, a nice thing to take away from a very stressful day at work.
I've definitely learned a lot today, and it's made me realise that so far in my medical education, I don't think I've had kind of any discussions or lectures on this topic. In your experience, did your medical school seem to do any education?
No, but George and I were both involved in like this, what do you want to call it, like a pilot or something, but where basically we were involved in a project where we were trying to educate the staff members. So they're a group of students that came together from like, it wasn't strictly from a hearing perspective, it was from sort of like inequality, diversity, inclusion, perspective, and we were trying to like make staff aware of different sensory needs and things like that. But I think they started to think about rolling it out to the students, and I think we did do some stuff with the first year students as I was finishing med school, but yeah, definitely something that there's definitely a space for it. And I think, like I said, a lot of the time it's not that someone's being malicious, it's just that they have no experience of it whatsoever. Like even before I struggled with my hearing, because my dad and my grandma and my aunt and uncle are all hard of hearing, even before I struggled with my own hearing, like I always knew how to talk around people who were hard of hearing. The first time I ever did shadowing, when I was like 17 in a hospital, I witnessed the nurses shouting in the elderly patients' ears because they couldn't hear what they were saying. And I would just look at them and speak to them slightly more enunciating what I was saying at normal volume. And they had way more of an idea of what I was saying than when somebody was shouting in their ear.
Well, I guess something that you've both spoken about there, I guess, is the ignorance, but hopefully in having conversations like during this episode, we're helping to combat that, because I also haven't had any teaching on this, so hopefully we can be making a bit of a difference here.
And another thing is that like peers, friends that I made during medical school, a lot of them did say to me that actually like being friends with me made them better communicators when they were with patients on placement. So like one of my friends working as a HCA came across a lot of older patients that were hard of hearing, and she said that she felt way more equipped to deal with that because she knew a bit more about what to take into account when communicating with those people. So
I would say as well, like some of the people who are really good at communication, you're kind of like, oh, like someone's cooked here, and then they'll be like, oh, my brother's deaf, or like, my best friend is hard of hearing, or like I learned BSL in primary school, and you kind of, if people have had some deaf awareness in their life, basically.
yeah, like the individual at one of the trusts that was like really advocating for me and making sure that I had extra things in place, she said to me it's because she had experience of a family member who was hard of hearing and the frustrations that they face. So again, it just shows that like obviously that gives people a motivation to be more clued up about it.
So, what kind of things should we be doing to be better communicators with our colleagues and patients who are hard of hearing?
I mean, I think it's always like there's always an element of different things work for different people. So there isn't like a one size fits all response. But I think a couple of things that we've maybe touched upon a little bit anyway is making sure you're facing that individual when you're speaking to them, making sure you're not covering your mouth like you've got a mouth full of food or something like that. And like not mumbling. I don't want to make a sweeping generalization, but where I am, a lot of people with like regional accents are quite mumbly. But like, yeah, so just being aware of like enunciating more, sometimes just speaking slower. Like you don't have to go super over the top with it, but and that can be offensive as well if someone's really like slowing down what they're saying and like talking like that. That can be really demoralizing as well. But like finding an in between where, yeah, and also recognizing when there's an environment that someone not where might be able to hear you. So like being like, oh, should we step outside and talk somewhere quieter? Or if you can see that like a colleague is struggling or like a fellow student, you could reassure them by saying, look, I'll fill you in of what was being said. Like I had a really supportive clinical partner during my placements, and they were always very reassuring. And if there were things I didn't hear, they'd be like, look, I'll catch you up on that afterwards. Or sometimes they would share the burden and inform other people about my hearing difficulty, because that was another thing as well. It kind of, I don't know if this becomes relevant in a later part of the podcast, but like there's the sort of like mental toll of essentially having to come out as deaf, like each time you meet somebody new, to be like, oh, by the way, I'm hard of hearing, could you please do XYZ? It's not realistic to do that every time you meet somebody new. And what's really helpful is sometimes somebody else will say, oh, look, actually, Benedict's hard of hearing, you need to make sure you do XYZ. And that makes a huge amount of difference.
I would also say one of the things for me is a thing not to do, and it's that thing where people say, oh, don't worry, it wasn't important, you didn't miss anything that was important. It's so frustrating, even if someone's just made a joke or like just said an off the cuff comment. Like it's not fair to not repeat it if someone's saying, please can you repeat that thing, and people do quite frequently say, oh no, it wasn't important, and you think, well, it's just quite frustrating, so don't do that.
Yeah, that's something that I've like really been like I've really drilled home to a lot of my friends, and they've subsequently become better at that. And what I try to explain to people is that it might not be important to the person saying it, and it might be a throwaway comment, or it might be something they've said under their breath, or they might say it and then think, why did I say that? But like to the person that's hard of hearing, it's like it's so important to them because it means that they feel included and they're not missing out on bits of conversation. Like there's nothing worse than sitting in a group and you feel like that you've missed the joke. And I think that feels the case even if you're in a one-on-one conversation and you ask someone to repeat themselves and they say, don't worry. There's nothing wrong with saying, oh, it's a bit silly, but this is what I said. But just discarding it, I think I can't really describe how demoralizing that feels. Like it's like a sinking feeling. It's like, oh, great, cool. Like I missed out on that. Even if it was like the most stupid throwaway comment. It sounds a bit dramatic, but like genuinely, when you spend so much energy trying to keep up with the conversation, trying to follow things, it can make a huge difference.
I guess we've spoken a bit about things like the supervisor or the mentor who did email for you, Benny, or other examples like that. Could we discuss maybe some ways that we can help if we have clinical partners who are hard of hearing? What can we do to help support each other?
Sure. I think that yeah, I mean, the most important thing is to like check in with that person to see what sort of level of interference isn't the right word, but what level of input they want from you, because I think that's important to play a part as well. Like you don't want to go under any assumptions that that person isn't capable of advocating for themselves or anything like that. But I think that the majority of the time they would appreciate the extra support as long as you could take that to them with an open mind. So checking in with them first and saying what would be helpful, like what would help you on placement, and then ultimately being led by that. But I think some of the key things is, if with their permission, you're able to be like, if you see somebody trying to communicate with that person and then they're not getting a response, just being like, oh, by the way, they're hard of hearing, like, could you perhaps speak up a bit, or make sure that they're looking at you when you speak to them, or you're looking at them. And just being aware of those little things that maybe we've touched on a little bit already, but things like making sure you're speaking clearly, making sure you're looking at the person when you're speaking to them, that you're not covering your mouth, being mindful of what sort of environment you're in and whether there's background noise and whether maybe you need to repeat yourself to them later on. And another thing that's been really helpful in the past is where I've been struggled with lectures content. I did have a note taker for lectures, which was very helpful, but in like seminar sessions where that wasn't really possible, sometimes my peers would offer to give me their notes from the session, or if it was a more informal session like a student like a peer run teaching session that didn't have the facility for a note taker, maybe the person doing the session would offer to me like a copy of the slides, or somebody else would offer me their notes from the session. So those were all things that were really helpful from a medical student point of view.
I think one of the things that students can do is ask their medical school for some deaf awareness training, or ask if they can do a 101 BSL course for medical students, knowing some signs, because as I said earlier, like this isn't just for communicating with your colleagues, but actually you're going to come across a lot of patients who are also hard of hearing, wear hearing aids. Also, a lot of the time in hospital, patients don't have their hearing aids in because they'll be somewhere with all of their stuff in another, in their bag somewhere, or people won't think to effectively communicate with patients. So it helps your colleagues, it helps your peers, but it will also help your communication in the long run with all patients. So I think, pestering your uni, say, I think some deaf awareness training is something that we would benefit from, or like a communication skills session where we're having to communicate with somebody who's deaf or hard of hearing. And I think our university actually did that in communication skills. We had a session where we had to communicate with a patient who was hard of hearing, which was really fun because me and the patient couldn't hear each other. So our communication was fantastic. But you just learn, you learn how to navigate these things, and I think it does get easier with time and the more awareness you have. So I think just simple things like saying to your university, this is something that you think is worth investing in and that you'd be interested in, is a good start.
it's great to like advocate for yourself and be like the face of change and want to make things better for other people, but you also have to balance your own well-being in that and make sure that it's not at that detriment, because like, even, you know, having a conversation about it on a podcast, like, it's great, and it's gonna do great things to like raise awareness, but I've kind of acknowledged the fact that I'm probably going to take it easy for the next couple of hours, because it is emotionally exhausting to talk about like the lived experiences and like some of the times that have been really rubbish. So yeah, it's really hard to balance that, but that's why I think that having like allies or advocates of people who don't necessarily suffer themselves with hearing loss, but might know somebody who does or might not, and they just want to improve their awareness, that can make a huge difference, because then the onus isn't just on the people who experience it themselves.
I think Anna and I could probably take that away and try and bring that change to our medical schools as allies. And I did want to thank you. I guess this being an experience, you sharing these stories with us. So thank you for your time. Thank you for coming on. And thank you, George, as well. That is probably all we have time for today. So I'd like to thank everyone for listening. If you enjoyed this episode, feel free to subscribe, and you will have another episode in 2 weeks' time. A huge thank you to George, Benny and Anna for coming on today. Make sure you follow us on all our social media, which will be linked in the description. Until then, I've been your host, Zaynah, and stay sharp. Bye!